Hello everyone, I am Dr. Anil Kamath. I am a senior consultant surgical oncologist here at Helios Cancer Clinic. So one common problem which we find among many people are enlarged or thyroid nodules. So how do we approach this? Now the thyroid can be enlarged due to various reasons. It's not an uncommon problem at all. And a very small portion of this can actually be cancer. So if anyone has got a thyroid nodule or a thyroid swelling, they need not be worried about it. At the same time, they cannot totally ignore it. A small percentage can be cancerous. So how do we evaluate this? I would like to talk about this. So whenever a patient comes to us with a thyroid swelling, then first we see the clinical characteristics of the patient. Nodules which are in the extremes of age, in very young people and in very old people, have got a higher probability of being cancerous and require more evaluation. Those patients with more symptoms like hoarseness of voice or difficulty in swallowing, these are the patients which require more thorough evaluation. Apart from that, we examine the thyroid and see how the nodule feels like, whether the entire thyroid is enlarged or whether there is only one nodule which is enlarged. When only one nodule is enlarged, it requires a more thorough evaluation. So this is how we decide based on clinical examination and this thing. The next thing which we need to do is radiology. This simple test that we do is an ultrasound of the thyroid region and the neck. So here the radiologist gives us a clue as to what this nodule can be. There is a rating given from 1 to 6 depending on how suspicious the radiologist feels the nodule is. While 1 to 3 are more on the benign side, the chances of malignancy is much higher from the nodules which are rated as TIRADS 4, 5 or 6. So these nodules require a much more thorough evaluation. The next test that we do is a needle test. This is usually reserved for nodules which are more suspicious. Nodules which are less suspicious on ultrasound are usually recommended only for observation, where we redo the ultrasound and clinical examination, say after 6 months, to see any change in size. The nodules which are more suspicious undergo a FNAC, where a small needle is put into the thyroid, preferably under ultrasound guidance. A small amount of material is aspirated and sent to the pathologist, where they see whether there are any cancer cells present or not. After all these issues, all these investigations, if the diagnosis is still uncertain, then we may recommend removal of that part of the thyroid. Thank you.